I am critical, very critical, of traditional westernized medicine. I am also very critical of the holistic, integrative, naturopathic approach to medicine too. I'm an equal opportunity critic, so I stand in the wonderful position of having the traditional medical profession, not all of them, but as an institution, hate me. The naturopathic community hates me because they think I betrayed them, because I walked away and said I'm a recovering naturopath instead of buying into their dogma. And so as I show you this, the key is, this is why it isn't about finding just an alternative doctor. It's about developing an alternative mindset, which is evidence drives the decision. I don't care if you're talking about taking an omega-3 fatty acid supplement or having a mammogram or how you're going to approach cancer treatment. Evidence drives the discussion. And it doesn't matter which initials are after somebody's name, MD, ND, Ph.D, RN, NP, pick some from the alphabet soup. If they don't follow the evidence, this person cannot help you. Okay? Now, the reality is, most people in medicine, regardless of the initials after their name, are not following the evidence. So you have to learn how to follow the evidence. The happiest days in my life are the days when my people call me, the members of my practice call me, and say, I am so proud of myself. I sat down with my oncologist, who's the head of the department at this very prestigious university-based medical center, and showed him in statistical terms why he's wrong about what he's telling me to do. That makes my heart sing. It's the reason I get up in the morning. Because this battle we're fighting for medicine, it's not going to get solved by hoping that guy's going to change his mind. It's going to get solved by consumers changing theirs. That's the key to this. So I want to make sure we have some time for questions, because I think you might have a few after all this. So this is my favorite quote. I use this in a lot of my presentations. While patients are grateful for new drugs and operations, what they really want is not to be patients at all. In this, we're failing them. And I think that's really the truth. I mean, many people, most people have allowed themselves to be sucked into the medical mill. And that's not where they want to stay. They're looking for optimal health. They're not looking for a better way to manage their symptoms and stay sick. But that's not what medicine delivers. So let's talk for a minute about how not to be a patient. And the primary thing you have to do is you have to start practicing proactive and intentional medicine instead of what I call reactive and episodic medicine. So reactive and episodic medicine means this. It's this mentality that I can eat, drink, and be merry. I'll get sick at some point in time. I'll take a drug or have a procedure or do something that somebody else will do to me from outside me to fix me, and then go home and I'll keep doing the things I was doing before. That's how Bill Clinton ended up in trouble. Continuing to eat cheeseburgers after the bypass surgery, as it turned out, not a good plan, okay? And then we just wait for something else to happen, and that's the way people live their lives. And I saw this myself. I've lost friends this way. Very wealthy couple that I've been friendly with for years. He died about 1.5 years ago. Here's how it happened. About 10 years ago, he started putting on weight. And he's known what I do for a long time. And he always used to joke around and say, I should listen to you. And I used to say, yeah, you should, but he didn't. So he started putting on weight, and he got to be pretty rotund. And then he had a blood clot in his leg, and they fixed that. And then he developed type 2 diabetes. You know, there are medications for that. None of this registering at all, okay, other than the occasional, I know I should be listening to you. And then he developed stage 4 pancreatic cancer, and you've never seen such a conversion in your life. I'm ready to do anything. Tell me to eat grass in the side yard. I'm in, okay? Well, you know, I'm really good at what I do, but I am not a magician. And that's what it takes to fix something like that at its very late stages, and in 4 months he died. So what killed him? It really wasn't the pancreatic cancer. It was ignoring all of the things leading up to the pancreatic cancer. Now, he died. What happens to a lot of people is they grow old, and every year they take a few more medications until they wake up one day when they're 82, and they're taking 15 medications, and you've seen people walk around with their pill boxes. And it's so unusual to see people in their 80s who don't take medications that people can't even believe that it's a possibility. Now, my dad's 85, and he doesn't take meds. He works at Wellness Farm Health 3 days a week. And he's the company proofreader. The reason why you don't see so many typos in my stuff now is my dad's, like, in the next office, writing herd on my writing style. So anyway, once in a while, he'll do one of these clinics at a shopping mall, has a health fair or whatever. And yeah, I'm going ahead and take my cholesterol. His IQ is higher than his cholesterol, by the way. But anyway, going ahead and take my cholesterol, and they'll say, how many, what meds do you take? And he'll say none. And they'll say, sir, I was asking you about medications. And he goes, I'm not deaf. I don't take any drugs, But nobody sees people in their 80s not taking drugs. So, it's such a shock. But that's how people end up this way, this reactive, episodic approach to healthcare where we just wait for things to go wrong. Proactive and intentional health is where you decide that health is a priority. And I want to talk about that for just a second, because I think part of the problem, part of the disconnect, is that people have decided, some people, that health is a priority, but they have established it as an end in and of itself. I want to achieve optimal health, okay? I do too. I think I have it right now. But that's not the thing. It's what that thing gives you. Optimal health gives you longer life, better quality of life, more time with family and friends, more time and energy to pursue the things that you want to do, like travel and read and cultural events. And, people like me, I can't get enough of anything I do. I have this disease called FOMS. It's called fear of missing something, all right? So if you want to live your life that way, you're going to have some health to make it happen. So we have to talk about optimal health, but I think we have to take it a step further, and we have to talk about what optimal health gets you, because that's what motivates people. People are more motivated to go take a trip to Europe than to have lower cholesterol. Let's face it, lower cholesterol is how you get to live long enough to take that trip. So anyway, you make health a priority, you resolve the health issues you have to the best of your ability, and then you work at maintaining your health like you maintain your car, like you maintain your house, like you maintain anything else that you have decided is valuable to you. That's how you practice proactive and intentional healthcare. And in order to do it, you're going to have to practice informed medical decision making. Because if you just show up and do what you're told in medical offices, you'll end up in a lot of the types of trouble that we've been talking about through this whole thing. So that is informed medical decision making. It puts the consumer in control. And people say, that's a great idea, but it's too complicated. Medicine is too complicated. Well, here's what I have to say about that. We all do things that are complicated. We buy things that are complicated every day, and we somehow manage to get enough information in order to make a decision. Now, I don't know about you, but I have no mechanical skills at all. I do not know how cars run. I know that when I put my key in and turn, the car comes on. I know how to turn it off, and I know how to call a mechanic if that doesn't happen. Now, that's the extent of my knowledge, but I've been buying cars for 40 years. Somehow I've managed to do that. How many of you have bought a house? How many of you know how to build a house? A couple. Okay, so how did the rest of us actually buy a house without knowing how to build a house? You get enough information that you don't have to know how to build the house to get enough information to decide if this is a good house to buy or how to evaluate that. And the same thing is true about medicine. Everybody can be taught to read studies, to interpret information, and to become an informed consumer. And I would say it is as important, probably a lot more important, that you do this with your health than you do this with your car and with the other things that you own.